Hi everyone, my name is Sienna Boyd and I am the community representative here at Rancho Family Medical Group. I am here with Dr. Susan Behnawa. She is one of our providers at our Sun City location. She is actually a geriatrician and we are here to talk about her and just get to know her a little bit more. So Dr. Behnawa, can you tell us a little bit more about your background, where you're from?
Yeah, absolutely. So the great thing about being at Rancho Family now is I'm actually from the area. So I actually was born in San Diego. I grew up in Anza until about second grade, and then we moved to Temecula. So I grew up in the area.
Born and raised.
Yeah,
love
absolutely.
it.
And then I went to UC San Diego for my undergraduate. I did my degree in physiology and neuroscience.
Okay.
And then my medical training I did out in Nebraska. I went to Creighton University, which is in Omaha. So a brief little foray into the Midwest.
How did you like that compared to California?
It was great. So we actually joked around because a lot of the medical students at Creighton were from California. So we joked that it was UC Creighton, but it was just great. The Midwest was wonderful. Everyone was really friendly and our clinical experience was great. And then I came back to the area. I did my training, my postgraduate training at UC Irvine. So I lived there for 3 years and I practiced at the medical center down in Irvine. And then I stayed there for my basically postgraduate training. So I did an additional specialization in geriatric medicine, and I did that at the University of California, Irvine as well.
Can you tell us a little bit more about geriatric medicine? Maybe a little bit more about what that is and how you got interested in that?
Absolutely. So UC Irvine has a very strong geriatric medicine curriculum. It's basically primary care for the older adult. So you're looking specifically about how the aging lifespan and age-related changes affect your medical management of certain diseases, things that you're watching for. It's a much more comprehensive and in-depth approach to primary care, and it's very, anticipatory based. You're trying to prevent things from happening and to maximize overall health as much as you can.
So it's more preventative, that's what I'm hearing.
Absolutely.
Okay.
And so I think that the way that as a geriatrician you look at a patient is you're thinking 10, 20, 30 years down the line, what are some things that we could be preventing in the moment here? And so a lot of my patients actually get a kick out of it because when they come to me, a lot of people are very, very young. They're in their 50s, their 60s, and 70s, and a lot of people aren't used to perceiving that as young. But we're living longer. People are living so much more meaningful, in-depth quality lives, and I think that, maximizing the health aspect of things is so important because you want people to be able to live very, very long, very fulfilled lives at the best possible health. And so that's really the focus of geriatric medicine, and that's kind of the different lens through which we view our patients.
I love that. Can you tell me a little bit more about your medical approach? Are you more holistic, or what is your medical philosophy?
Absolutely. So I joke that I am probably the quintessential nerd. I do everything very evidence-based. I think that in medicine, we tend to follow certain paradigms and certain structures, and I think it's really important to understand that medicine is a practice. We're constantly evolving and we're constantly changing our approach to optimize overall health. And so I think that the key thing that I really strive to do in my practice is I strive to individualize your care. And so whereas, someone might say all heart patients should be on X, Y, and Z medication, well, we look at you as an individual. Are these working for you? And contrary to that, well, all heart patients should be on these medicines. What's the reason you're not on them? How can we optimize this for you? And so taking our strategies in healthcare, knowing what works well, what's evidence-based, what we have good, research into, and then really looking and seeing, is this the right fit for you? And if not, what else could we potentially do? And so I think that really for me comes from the medicines, and it's so, so important for me to understand what you're taking, why you're taking it, if you understand it, because that optimizes you to, take advantage of your ownership of your own health. And so I think that is probably the most important thing, is focusing on the medicine. Are we doing a good job, and are we doing it right? And then once we have that down, taking a big step back and saying, well, what does the rest of your world look like? Who do you live with? Who's your family? Who are your friends? Who's your support system? What does your diet look like? What does your exercise look like? Bring all of those things in. We as individuals don't live isolated in a bubble, and so it's so important to have a clinical context of your patient, not only as an individual, but within the society that they live in. And so for us here at Rancho, it's really important to us to be a community resource, and part of doing that is being able to understand alternative therapies, not just here's the medicines that work, here's why they work and why they're great, but also, well, what about Tai Chi? What about yoga? What about balance and strength training? All of these things, I think when you come to the table with a multifactorial approach, you can really do great things for the patient.
I think that's wonderful. What I'm hearing is not only do you individualize a patient, but you make sure that no matter what their need, that you're there for them and you're able to really specialize in what their needs are.
Yeah,
so that's
absolutely.
really wonderful to hear.
I think one of the most sacred things about being a physician is we become part of the fabric of our patients' lives. We are the backbone for them, whatever health need that they have, and that's something that trust isn't given to us lightly by our patients, and we're so honored to be able to be a part of their stories and their lives and to be there for the most difficult times. When you're sick, it's not an easy thing to be sick, and for us to be able to guide our patients through that, help them come out the other end, help them with anything else that they're dealing with, I think that that's so important, and we're so lucky to be able to do that as physicians.
I love that. That is wonderful. Well, switching gears a little bit, can you tell us a little bit more about what kind of fun activities you like to do outside of the office?
Yes, so actually when I first came out of my medical training, there's almost a joke because you're so busy studying medicine, you're in the hospital, you're doing nights and weekends, so then you come out and then you have to remember, oh, I'm a person also, what are my hobbies? And I think that a lot of people get wrapped up in that as well. They're a caregiver for a loved one or they have young children and they really forget taking time to prioritize themselves. And so for me, things that I love, I absolutely adore doing, which I think is very strange. I'm a big fan of organizing and decluttering. I think I was part of the first wave of the whole, KonMari, because I think that living an intentional life is really important. And so I love actually going to my friends' homes or my family's homes and saying, hey, let's get organized.
What sparks joy in your home?
Exactly.
Okay.
And I think it's such a satisfying process because it really puts you on the spot where you have to prioritize meaning. And if something's not contributing in your life, making room for things that do. And so
I feel like that would really then tie into how you would treat a patient as well, is asking them, okay, what kind of things in your life do not spark joy or don't bring meaning, and maybe that can contribute to not only your mental health but your physical health as well.
Definitely.
Okay.
And I think that especially in geriatrics, you're looking at these medication lists and sometimes they're 2 pages long and people have bottles all over for things that were stopped and maybe they're not supposed to be taking. And so being able to come at situations with an eye for decluttering and a mind for what needs to be there and what we can eliminate, I think really adds to overall quality of life.
That is so neat. I love that. That is a little unique, and I wish I was more like that, but I love that.
Normal people like to ride bikes or whatever.
Go
we love
hiking.
to organize the closets. No, and I think that another big thing for me is really focusing on experimenting in the kitchen and learning how to prepare healthy meals for my family. So I have a 4-year-old, my son is 4, my daughter is 2, and it can be really tricky to fall into the trap of, well, what's for dinner tonight? What's easy? What can we put on the table? And so really, I think the biggest thing with my children is engaging them in the cooking process. They'll eat things that I never would think that they would eat. Like I had my son cut up some mushrooms the other day, and he's so excited to eat it and try
your
it.
son's the 2-year-old?
He's 4.
He's the 4-year-old.
He's the 4-year-old, and so he loves
he eats
helping
mushrooms?
me in the kitchen. He does.
Okay.
He's so funny. He's my healthy eater. So I joke that my son is all meat and vegetables, and my daughter is all carbs and cheese.
I'm your daughter.
So, yeah.
All carbs and cheese.
And so I think for us as a family, we like to offer everything and try to engage the kids, which usually leads to a lot of messes, but at the end of the day, they're more willing to try the food. And so that's been a lot more fun as both of my children are becoming more independent, to involve them in things like grocery shopping and cooking.
That's so fun.
Even my son will say, oh, can we have squash tonight? Because he loves to slice up the squash in we have a little mandolin that slices it, or we'll make the zucchini noodles with a spiralizer, and he loves to spiralize
that's so
them.
fun.
So just getting my kids engaged in the cooking process, they have a really good time, and then they actually eat the food, which is surprising.
Parenting hacks, everyone.
Yeah, so I think just, not assuming that your children won't eat a certain food, just being open-minded and presenting it.
Yeah.
And then so my son actually tells me, so they watch some Daniel Tiger on PBS, and there's a song where they sing, you got to try new food because it might taste good. And so my son, I won't sing it to you because I can't sing at all, and I'll spare you that horror. But so my son will sing it to me when I'm not open to trying new foods, and it's just so funny because they're their perspective of the world is so fresh, and if you keep them open-minded, then they're constantly challenging you as well.
I love that.
Yeah.
Oh my goodness, that is awesome. I'm going to ask you one last question. If you wanted to tell your patients one thing, or if you wanted all of your patients to know one thing, what would it be?
I think the biggest thing, and that I've been talking a lot about lately in the clinic, is a lot of patients are struggling with a sense of a lack of control in their lives, being at home, being in situations that they can't control. And I think that a lot of people are struggling with unanticipated weight gain, for lack of a better way to put it. A lot of people are dealing with, stress, boredom, irritation, frustration, and just having greater access to food overall. And so we're seeing a lot of patients who are coming to us and saying, well, how can we get this weight off? And I think the biggest thing for us is, I think first of all, coming from a place of kindness and understanding that in a pandemic, you're going through a lot, your body is going through a lot, and there's a lot of hormonal components to weight gain as well. Cortisol is a stress hormone and it makes you gain weight. And so what a lot of our patients have been able to do just in this last several weeks to months is, and I highly encourage everybody to look into it, is they've been able to learn more about intermittent fasting, which I think is such an overlooked health tool. When you talk about intermittent fasting, you're basically taking all of the nutrition and the food that you consume in a day, and you're cutting it down to a certain window of the day. So let's say if you want a certain time frame, you start eating, at 10 a.m. and then you're done eating by 4 p.m. So that's a 6-hour eating window. And within your eating window, if you focus on eating really wholesome foods, vegetables, some maybe meats, full fat dairy, some nuts, things like that, if your body can tolerate it, and really limiting processed foods and really, lots of breads, rice, cereals, pasta, it's okay, but I think in moderation, you'll feel so much better overall. And I think if you look at the types of foods that you're eating and trying to choose foods that nourish your body versus, serve you in that moment of stress, I think overall you feel so much better. And so I think just going back to what we were talking about before, where sure, medicines are great, but they're only going to do so much. What you choose to put in your body and what you choose to do with your body, ultimately at the end of the day, that's going to be the biggest health determinant for you. And so I always tell my patients, if you're trying to be more mindful about the foods that you're consuming, first and foremost, be kind, because you're not going to get anywhere from a place of judgment or irritation with yourself and your food choices. Focus on whole, real, processed foods. I had a patient who was, I was having this conversation with, and they were saying, I had some whole wheat toast for breakfast. Isn't that a good choice? I said, well, you can't really go and pick it off of a tree. So when you think about unprocessed natural foods, you're thinking about things like vegetables, certain types of fruits, eggs, things of that nature. And she just laughed. She's like, I've never thought about it that way. Because you think about processed foods, we have an idea of what food should look like and what it doesn't. And so I think that one thing for our patients that can always be a starting point is look into intermittent fasting, getting your food to where you're eating it at a time where it serves your body, and also within your window, the foods that you're choosing also serve your body. I think coming at it from a place of positivity and kindness really sets you up for success.
I love that.
Yeah, so Dr. Madrid and I actually talk about this all the time, because Dr. Madrid is a huge proponent of intermittent fasting. He's gotten a lot of his patients, off of their blood pressure medicines, off of their diabetes medications with successful weight loss, and intermittent fasting for those patients was such a big success contributor for them. And so it's actually great. So the You Can Choose Health website, Dr. Madrid's actually put together a really nice series for our patients that kind of goes through what it is, what it looks like, and how to make it accessible for your life.
If any of you at home are interested in intermittent fasting or the keto diet, you can go ahead and log on to youcanchoosehealth.com to find all of our educational resources all about intermittent fasting and keto. Dr. Behnawa, thank you so much for joining us here at our senior center here at Rancho Family Medical. We are so happy that we got to meet with you and talk to you today.
Absolutely. Thanks for having me. This is where I am all the time. You know where to find me. Feel free to circle back if anything else comes up.
Thank you.